wash hands and put goggles and gloves. I'm already done to wash my hands. Now, I'll put the gloves and the goggles. Now, assemble the equipment and materials. Salt, toilet tissue, ice cube, pen light, and ticking wash, cotton applicator, sugar solution, and tongue depressor, and newspaper. Good morning, sir. I'm Narag, and I'm your nurse for today. Let me know your name, sir. First day, sir. Now, sir, I'll examine your cranial nerves. The procedure that I'm going to do is to examine your cranial nerves to identify any abnormalities that can affect any factors in your daily activities. Sir, tatanungin lang po natin, ano po mas English or Tagalog? Olfactory nerves. Check that nasal passage are clear. Next, ask the patient to close his eyes and shut one nostril with the fingers. And next, present a well-known odors, might, coffee, chocolate, and ask the patient to sniff and identify. Next, sir, pikit po tayo. Sabihin ko kung ano itong naamoy, no? Next, optic nerves. Afferent to the brain, responsible for the sense of vision, visual acuity. By using Snellen, chart 6 meters away from the patient, testing each eye separately. If the patient uses glasses, ask them to put them on. So, sir, pagpili ano po natin. And then, tuturo ko po to kung sabihin ko yung ito, ha?
Sleep, sleep, wake, sleep, sleep, 8, 5.
So, sa kabila po, sir. Pagpili natin.
A, C, 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 A, B, C.
Next, visual field. Ask the patient to cover one eye and look directly into your position eye, and shut your other eye to wiggle your finger in each of the four quadrants, and ask the patient to state when the fingers is synced. So next, ma'am, pag-close pa natin yung so, titignan nyo na po yung mata ko and titignan nyo to, ha? Yung nakatingin lang po kayo sa mata ko, ma'am, ha? Sabihin nyo kung nakikita nyo po, ha? Ilan
Yes.
to?
1, 1, 1,
Sa kabila po.
1, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116,
Next, oculomotor nerves. Examine for 3, 4, and 5 nerves. So, sir, yung eyes niyo po. Sir, next, I will examine the accommodation. So, sir, tingnan po natin. So, next, the age shape. So, sir, yung mata lang po natin yung titignan siya. Huwag po natin gagalagin yung right po. Okay. Right po. So, sir, the X shape. Next, I'm gonna examine the trigeminal nerves. Um, Inspirational face general sensation by touch, pressure, temperature, pain, and vibration. So, relax lang siya. Now, interior 2 to 3 of the tongue. Ano yung natitipan mo siya? Ano siya?
Sol.
Examine the muscles of mastication. After examining the muscle of mastication, note any wasting of muscle mastification. And next, ask the patient to clench his teeth, then feel the masseters and the intimator bulb. So, ate, sir, I'm gonna examine the corneal reflex using a damp cotton wool. Now, next is jaw jerk or reflex. So, sir, ano po yung mukha? And use the hammer. I'm gonna assess the facial nerves. Taste sensation of interior 2 to 3 of the tongue by applying cotton buds on the patient tongue, dip or in sugar, salt, vinegar, solution with rising is mouth of between each test. So, now I'm gonna check the motor and note any symmetry. I'm gonna examine the corneal reflex. And next, the clavellar tap. Now, I'm gonna assessing the vestibulocochlear nerves. Sir, may sasabihin po ako na sabihin ko.
Sunday.
I'm gonna assessing the glossopharyngeal nerves and vagus nerves. Unpleasing test, use the more reliable water swallow test instead. and observe for absence, swallow, cough, or delayed cough, or change in voice quality. Next, say answer. Ah. And look at the movement of the platelet or abula. Ask the patient to puff off his cheeks with the lips tightly. So, sir, balon ko yung lips. Palagi. And close and feel for air escaping from their nose. Now, I'm gonna assessing the accessories of nerves. Observe for any shoulder or neck muscle wasting or hypertrophy. And shrug shoulders against distance. Inhale. Exhale. Inhale. Inhale. Now, turn head against resistance. Now, I'm gonna assess the hypoglossal nerves. Fasciculation or involuntary movement, and protrude tongue and look for any vibration or involuntary movement. Sir, huh? Now, move tongue from side to side. So, sir, palabasin nyo na and galawin natin side to side. Next, test power by asking the patient to press his tongue against his cheek while you applying pressure from the outside. So, sir, press nyo yung tongue, sir. Okay? Press ko, press. Assess speech and swallowing. So, anong pangalan niyo po, sir? And lastly, document the findings and hand washing.